1 in 3 American adults has fat accumulating in their liver right now, and most of them have never been told. This is not a disease reserved for heavy drinkers. Research shows that non-alcoholic fatty liver disease is primarily driven by diet and metabolic habits, and it is completely reversible in its early stages. The question is not whether your liver can recover. Research confirms it can. The question is whether you know what to change and why. A 2016 study in hepatology estimated that non-alcoholic fatty liver disease now affects approximately 25% of the global population, making it the most common liver disease in the world. More alarming, the condition progresses silently. Most people with fatty liver feel nothing unusual until damage is advanced. The liver has no pain receptors. It cannot signal distress early. By the time you feel symptoms, significant damage may already exist. This video draws on landmark research in hepatology. A 2016 meta-analysis in hepatology documented global fatty liver prevalence. A Journal of Hepatology review analyzed lifestyle interventions that produce measurable liver fat reduction. Research published in Gut demonstrated how exercise specifically reduces liver fat independent of weight loss. And the PIVENS trial in the New England Journal of Medicine tested vitamin A alongside lifestyle changes for liver inflammation. The most dangerous myth about fatty liver is that it is a drinker's disease. Alcohol-related liver disease is a distinct condition from non-alcoholic fatty liver disease, and the non-alcoholic version is now far more common. Research is unambiguous. NAFLD is primarily driven by excess calories, particularly refined carbohydrates and fructose, combined with sedentary behavior and insulin resistance. You can develop significant fatty liver while consuming zero alcohol. Your lifestyle is the cause. The liver has a remarkable capacity for regeneration, but it has its limits. Untreated fatty liver follows a dangerous progression. Simple steatosis, fat accumulation, progresses in some patients to NASH, non-alcoholic steatohepatitis, where fat combines with inflammation. From there, fibrosis develops, scar tissue replacing functional liver cells. Eventually cirrhosis, irreversible structural damage. Research estimates that approximately 20% of people with fatty liver will progress to fibrosis within a decade if the underlying habits don't. Research using liver biopsy and imaging tools shows a stark contrast between two metabolic states. One person eats a processed food diet high in fructose and refined carbohydrates, sits for most of the day, and has developing insulin resistance. The other eats whole foods, exercises regularly, and maintains insulin sensitivity. After 5 years, the first person's liver contains measurable fat accumulation with early inflammatory markers. The second person's liver remains clean. The difference is entirely metabolic and entirely habit-driven. The Journal of Hepatology review by Romero Gomez and colleagues synthesized clinical trial evidence on lifestyle interventions for fatty liver. Their analysis found that a combination of dietary modification and exercise produced measurable reductions in liver fat in all studied populations. Most importantly, they found that even modest weight loss, as little as 5% of body weight, reduced liver fat significantly. Exercise has a specific effect on liver fat that goes beyond simple calorie burning. Research published in Gut by Ryan and colleagues demonstrated that aerobic exercise reduces liver fat content even without significant body weight change. The mechanism involves increased hepatic fatty acid oxidation. The liver literally burns its own stored fat during sustained aerobic activity. Both aerobic and resistance training show benefit, but combining them produces the largest liver fat reduction in the clinical literature. Dietary factors have clearly defined roles in liver fat accumulation and reversal. Research has identified the key dietary drivers with precision. Fructose, particularly from added sugars and high fructose corn syrup, is directly converted to liver fat through de novo lipogenesis. Refined carbohydrates spike insulin, promoting fat storage in the liver. Saturated fat in excess contributes to liver inflammation. Conversely, olive oil, omega-3 fatty acids, and fiber have all shown protective effects in liver health research. The Mediterranean diet has the strongest research support for fatty liver reversal. A clinical trial published in the Journal of Hepatology found that participants following a Mediterranean-style diet showed significantly greater liver fat reduction compared to standard low-fat diet advice. The Mediterranean pattern works through multiple mechanisms simultaneously. High olive oil content reduces liver inflammation, omega-3s from fish reduce triglyceride production in the liver, and the high fiber content improves gut microbiome composition, which directly influences liver fat metabolism. Research supports a clear step-by-step approach to fatty liver reversal. The protocol has 4 distinct phases. First, eliminate the primary drivers, sugary beverages, high fructose foods, and highly processed carbohydrates. This reduces the liver's fat input immediately. Second, add structured exercise. At least 150 minutes per week of moderate aerobic activity plus 2 resistance training sessions. Third, shift toward a Mediterranean eating pattern. The timeline for fatty liver reversal has been mapped in clinical studies. Research shows that with consistent lifestyle changes, measurable improvements in liver fat appear within 4 to 12 weeks. Most people doing the full protocol, diet change plus exercise, see significant liver enzyme normalization within 3 to 6 months. Ultrasound changes, visible reduction in liver fat density, typically take 3 to 6 months as well. Research-backed actions for fatty liver reversal are specific and actionable. Stop all sugary beverages immediately. Soda, fruit juice, energy drinks, and sweetened coffee all deliver fructose that goes directly to liver fat production. Walk 30 minutes daily. This alone shows liver fat reduction in sedentary individuals. Add 1 serving of fatty fish twice weekly for omega-3s. Replace refined grains with legumes and vegetables. The research translates into clear daily decisions. If you currently drink 1 soda per day, then you are delivering roughly 25 grams of fructose directly to your liver each day, the primary substrate for liver fat synthesis. If you replace that soda with water and walk 30 minutes daily, then clinical studies predict measurable liver fat reduction within 8 to 12 weeks. Non-alcoholic fatty liver disease is the most common liver disease in the world, and it is largely reversible with the right habits. Research is unambiguous. Removing fructose and refined carbohydrates, adding exercise, and shifting to a Mediterranean eating pattern produce measurable liver fat reduction within weeks to months. The liver is one of the most regenerative organs in your body. It wants to heal. Your liver does not have pain receptors. It cannot tell you it is struggling until the damage is significant. But the science has given us the tools to intervene early. Start with 1 change this week. Eliminate sugary beverages. Add a 30-minute daily walk. Ask your doctor to check your liver enzymes at your next visit. These are not dramatic sacrifices. They are precisely what the research says your liver needs to begin recovering. Give it that chance.